Premier of Ontario is blue-skying a plan to fix the medical profession in Ontario. He is saying that certain operations, certain things can be done outside of hospitals. The NDP, in their knee-jerk reaction, are saying that's privatization. That is medicine for profit. It will never happen. Dr. Shawn Whatley, he was a medical doctor, president of the OMA in the past, author of this book, When Politics Comes Before Patients. We're going to talk about politics coming before patients. Thanks for joining me. When the Premier is saying we are going to have certain operations done by private sector, is that bad or good?
Well, the emphasis is on expanding public services. So he said over and over, you will not pay for care with your credit card. You're paying for it with your OHIP card. So this is a process that's been happening since the 1970s. We've been shifting services out of the hospitals. In 1970, the hospitals accounted for 45% of healthcare spending. In 2020, they account for 26%. This is a good thing. We are doing services outside hospitals that can be done safely with high quality care covered by your OHIP card.
So, doctor, it's not as though we have a bunch of businessmen, terrible people, making profit, saying, we're going to saw off this guy's leg and charge him an extra fee for it.
Absolutely not. These are OHIP set fees.
Okay, so is that the answer to the poor medical care that many Canadians are experiencing now? To have operations done by outside companies?
It's a small step in the right direction. The issue is not who does it, it's who manages the care. So currently right now, for example, an MRI scan done in the hospital is managed by the whole administrative setup within a hospital. If you can move that outside of the hospital, you have an independent health facility which has a much more nimble management structure. Essentially, Ford got activity-based funding, which we haven't been able to get for 20 years, by bypassing the hospital system and going to the independent health facility.
You use the adjective nimble. So nimble to me means it may actually be a better treatment. And secondly, is it going to be the same price as it would be in the hospital?
Same price, but lower costs. Auditor General in 2012 found that identical services done in hospital and out of hospital cost 20 to 40% less with the same or better quality and access for patients.
Now, doctor, I know you're far too polite. More polite than I am. So I call these people who are saying privatization's bad, I call them dinosaurs. But is that a political argument that still has to be won out, or is it still hot?
Canadians have forgot what it means to be public or private. Public, you could think of the post office. The government owns, runs, staffs, and operates the whole thing. Private is more like your daughter's lemonade stand. Healthcare is somewhere in the middle, heavily regulated, but we really don't have control over the price, services, customer, or management. And so we need to have that discussion about what exactly is private care, because what Ford's talking about is not private.
This is why you're here today. Thanks very, very much. 3 minutes. Thank you for contributing. We are almost out of the hole. People like the show, and we want to keep it on the air. So press subscribe, press PayPal. PayPal is really simply a credit card that you can pay with. And if you're writing a check or a letter, please put your address in, because I will send a letter to everybody who contributes money. Subscribe, PayPal. Thank you.